Hello friends, how are you? Hope you are doing fine. So today in this video, we are going to learn about aortic arch derivatives and fetal postnatal derivatives. So in aortic arch derivatives, there come first, second, third, fourth, and sixth arch. So starting with the first arch forms the inferior alveolar branch of maxillary artery. Second arch forms the stapedial and hyoid artery. You can remember that in second S comes, and from S, stapedial artery. All stapedial artery also starts with S. So SS. Okay, from for second arch. From for first arch, you can remember that first person is Max. First person is Max. Max is the name of a boy or a person you can correlate. So Max is the first person. So maxillary artery is derived from the first arch. And which branch of maxillary artery? Inferior alveolar branch of maxillary artery derived from first arch. Coming on to the third arch. Third arch forms the common carotid artery and proximal internal carotid artery. Third arch, C is the third letter of the alphabet, so all comes C. C comes in the third part, common carotid and internal carotid. From fourth arch, right fourth arch forms the right subclavian and brachiocephalic artery, and left fourth arch forms the arch of aorta. From sixth arch, you can remember pulmonary artery and ductus arteriosus only on the left side is formed. You can remember it by that there are six police department. Police department stands for PD, and from P you can remember pulmonary artery, and from D you can remember ductus arteriosus. So if someone asks you how many police departments are there are six police department. So from six police department you can remember that from sixth arch pulmonary artery and ductus arteriosus is formed. So after aortic arch derivatives, we coming on to the fetal postnatal derivatives. Fetal postnatal derivatives, ductus arteriosus in the fetal life form the ligamentum arteriosus in the adult life. Ductus venosus forms the ligamentum venosum. Left umbilical vein forms the ligamentum teres of liver. You can remember that by left there is L for left, L for ligament, L for left and L for ligament. Okay, from right umbilical vein, nothing is formed. Right umbilical vein disappears in the adult life. Coming on to the next part, vitalo-intestinal duct forms the Meckel's diverticulum. You can remember easily this by in vital, tel comes, and in Meckel's me comes. So you are asking someone or saying someone, tell me. So by remembering the phrase tell me, you can remember from tell vital and from me Meckel diverticulum. Coming on to the next part, urachus. Urachus is a part of allantoic duct between umbilicus and bladder. So in allantoic, AN comes, and in median AN comes. So where AN comes, AN comes, AN comes, AN comes. So in allan, AN comes, in median, AN comes. Student, student confuse in this median and medial. In when AN comes, in allan, in median AN comes. In umbilical, umbilical, medial comes. So umbilical artery from the medial umbilical ligament. So it is important to learn. So after you all can see that there is pig here and he is sleeping, he is lying down, he is lying down. In Hindi, lying down means leta. Leta means late. So late umbilical fold forms the epigastric artery. Inferior epigastric artery. After coming on to the next part, proximal part of umbilical artery forms the superior vesical artery. We all know that pro person are super cool or super whatever. Pro person are pro means someone is pro in something. So pro person are super cool. Pro person are super cool. Pro person are super cool. So from pro you can remember proximal part of umbilical artery, and from super you can remember superior vesical artery. And we all studied earlier that distal part of umbilical artery forms the medial umbilical ligament. Okay, and last is foramen ovale. By foramen ovale, fossa ovalis is formed. You can watch out ovale. Okay, thanks for watching the video. If you have any suggestion, please let me know in the comment section. Bye bye.